Hello, welcome to the fall edition of the Director's Cut. I'm Candace Fabi, CEO and Medical Center Director of the VA St. Louis Healthcare System. The VA St. Louis Healthcare System provides exceptional care and services to our veterans, but we can't do it without our small army of dedicated VA staff. Today, you will get an exclusive behind-the-scenes look at life at VA St. Louis and how we coordinate care and services for our veterans. First, you will learn about our home-based primary care program and how we provide care to veterans in their homes, followed by our research program and all of the clinical trials that we coordinate. Last but not least, you'll learn about our comprehensive surgical program and our state-of-the-art equipment. See you on the other side.
The program, if you think about it, really kind of caters back to how we used to practice medicine, where we'd have providers, physicians would be going into patients' homes, see them where they live. Our program is very similar in that way.
There are a lot of veterans who live out in the community who have no feasible way of getting to appointments. Many of the veterans that we see are bedbound. They may have a lot of chronic conditions, and this just makes it very difficult for them to get out into the community to come see a provider at the clinic. And so that's why we go to them.
Each patient I try to deal with individually. Everyone is their own individual, their own healthcare issues. And my ultimate goal being the nurse manager is helping them with their own illnesses and understanding of what's going on.
How I found out about the program, I had a cousin just download everything from VA and she filled it out. And someone came and knocked on my door and it was like a God sent person, you know. The guy came in and he told me about the program, and because I was in a frantic because I couldn't do anything. It was hard on me. And he suggested they send me home health care. The nurse came out. The therapist came out. Everyone has been all the nutrition people, and everybody been so great helping my husband. You know, I don't know what I would have done if I didn't have this program.
I run the research department for the St. Louis VA healthcare system. We do a lot of research here, including a lot of clinical trials to really grant access to our veterans to the latest therapies that are available out there are being tested in cutting edge clinical trials. We do quite a bit of basic science research. That's research on the fundamentals of disease. That's really to help us understand why disease happens and how it happens, in the hope that we'll be able to discover therapeutics or treatments to help people or veterans affected with those diseases. We do also a lot of clinical research to help orient us to understand how diseases form, who gets them, and why. And really, all of this really is geared toward helping us understand problems that our veterans are suffering from and helping us alleviate that suffering, helping us discover new treatments and new ways of ameliorating those diseases that impact the veteran population.
Our clinical research here at the VA has really helped improve the lives of so many veterans, and we want to be able to help those veterans to live exceptionally beyond 50, 60, and 70 years old. And so we have come together with pharmaceutical companies to try to establish clinical trials access here within the VA.
Anything that we do here at the VA for research purposes, we're looking at vaccinations, medications, medical devices, diagnosis and treatment methods in general. And so what we're doing is advancing the science, but also keeping the veteran in mind as well. And so having those better health outcomes based on, the aforementioned topics that I just said, providing better outcomes, pushing the science forward, not just here at the VA, but, for science and healthcare in general.
At VA St. Louis Healthcare System, we provide a very comprehensive spectrum of surgical treatment
It includes inpatient and outpatient procedures that range from excision of benign soft tissue lesions to complex hernia repairs, orthopedic procedures, spine operations, gynecologic procedures, open heart surgery. I'm very proud of our state-of-the-art operating rooms. We have a single plane hybrid operating room as well as a biplane hybrid operating room. We also have advanced intraoperative imaging modalities such as our O-arm, which is a 3D intraoperative real-time CT scanner that our neurosurgeons use when they're doing complex spine surgeries.
We also have a full spectrum of high definition cameras that are used for minimally invasive surgery, and that's used by many different specialties in our hospital. And we have a dual console robotic system that I'm fortunate to get to use all the time, very excited about. And it really allows us to do complex robotic surgery, and it allows our trainees to get up to the date training. Our veterans are encouraged to be involved in every step of the process and to really give us their expectations and the goals that they want met.
Serving those who have served our country is something I know our providers hold dear to their hearts, and that is very, very encouraging.
Yeah, I agree, Dr. Patel. As a member of the surgical team here and a veteran myself and someone who gets his care here, I truly believe that the surgical staff here are committed to understanding the unique aspects of veteran care and dedicated to providing the best care possible.
I really hope you enjoyed today's Director's Cut, so be on the lookout for future episodes. Our goal is to better help connect you with the wonderful mission that we do here at the VA. And please remember to be the change you want to see.